Hello everyone. So today we are going to start with thyroid gland. Firstly, coming up with the functions, it secretes triiodothyronine and thyroxine T3 and T4. It regulates BMR. It provides the psychosomatic growth of the body, and it modulates calcium 2 metabolism. Coming to the special features. So it is the only endocrine gland that is superficial, so easy for the physical examination. Depends on the external environment. The raw material is iodine. Rich blood supply, does not secrete directly. Firstly, it is stored and then released as per the requirement. Okay, moving on, coming to this. Thyroid gland apex faces upwards. Apex is always upwards. You see here. Apex is upwards. Apex is upwards. The weight is 25 gram and it is 5 into 2.5 into 2.5. These are the dimensions. The isthmus. Isthmus is, as you can see in this picture, the isthmus is a connective tissue that is going to link these two lobes of the thyroid gland. These two lobes of the thyroid gland. So this is the isthmus. Make a note of it. And it is 1.5 into 1.5. Sorry, 1.25 into 1.25. So moving on, there are three surfaces. So we have a lateral surface, a medial surface, and posterolateral surface. Lateral surface is related to infrahyoid muscles, sternocleidomastoid muscles. The medial surface is related to the two tubes, trachea and esophagus. Two cartilages of larynx are thyroid and cricoid, and two muscles are inferior constrictor and sternothyroid. Coming to posterolateral surface is related to the carotid sheath and overlaps the common carotid artery. Coming to the relations, we have apex and base. As I told you initially, it is directed upwards. Apex is directed upwards. It is sandwiched between inferior constrictor and sternothyroid. How will you remember that? I'll help you correlate here. This here and this here is same. So please remember like that. Now coming to the base. It is directed downwards at the level of 4th or 5th tracheal ring. Okay, now next up, coming to the capsule. Now thyroid has got a true capsule and a false capsule. The true capsule is peripheral condensation of the connective tissue of the gland. Plexus formed inside the capsule, and during thyroidectomy, that lobe should be removed along with the true capsule to avoid excess hemorrhage or bleeding. While removing the prostate in males, retain the true capsule. Coming to the false capsule, it is derived from the pretracheal layer. It is an important MCQ. Please make a note of it. The diagram over here is important. This is the best and the most easy diagram you will ever find for the capsule of the thyroid gland. And make a note of all the diagrams that I've given you. You should be able to make a rough diagram of this also. Now coming to the blood supply. Blood supply of thyroid gland is very interesting indeed. So firstly, we have superior thyroid artery, that is the branch of external carotid artery. So it is going to go from the apex, so anteriorly and posteriorly. So basically anteriorly runs anterior border medially over the isthmus, and superiorly it is going to anastomosis with its counterpart on the opposite side. It is going to run along with the external laryngeal nerve. This is also an MCQ. Okay. And the diagram is very important here again. Now coming to the inferior thyroid artery, that is the branch of the thyrocervical trunk. It arises from the subclavian artery and it runs upwards. Okay, so it runs upwards, first upwards medially. Finally, it is going downwards to reach the base, as you can see, of the gland. The artery is then going to divide into 4 to 5 glandular branches that then enters the parenchyma. Then one ascending branch, anastomosis with the posterior branch of the superior thyroid artery, and also runs along with the recurrent laryngeal nerve. This is an MCQ again. Now only 3% individuals, thyroid artery is supplied by the lowest thyroid artery. Thyroid MR artery that arises from the brachiocephalic trunk. Accessory artery is present sometimes. Coming to the venous drainage, it is very simple, but questions are asked on this as an MCQ, or you should just know it for the Viva. And if I have not told you this yet, thyroid comes as an LAQ. So please make a note of it that thyroid is an important LAQ. And many times people ignore this, but it might come. So now coming to the superior thyroid vein, that superior thyroid vein is going to drain into the apex, like it goes from the apex of the lung, as you can see, into the internal jugular vein. Please remember the diagram. The diagram here is very important and very easy also. Inferior thyroid vein goes into the isthmus into the left brachiocephalic vein. Middle thyroid vein again goes into the isthmus into internal jugular vein. Thyroid vein of Kocher, base of lobe, goes into the internal jugular vein. Coming to the nerve supply, it is basically derived or mainly derived from the medial cervical ganglion, partly derived from the superior and inferior cervical ganglion. Coming to the applied anatomy, in thyroidectomy, inferior thyroid artery should be closed away from the base, superior thyroid artery should be packed closely to the apex. Congenital ectopic thyroid, abnormal placement of the thyroid tissue due to the improper migration of the thyroid gland during embryonic development. Coming to histology, this is very important, even in practicals, very important, and even it comes as an SCQ also. So thyroid follicle is an oval shape surrounded by single layer of epithelial cells and filled with gel-like material called as colloid. As you can see the thyroid follicles, and then it is surrounded by the epithelial cells, and you have got colloid in between that is going to contain thyroglobulin. It is a precursor of the thyroid hormone. The function is to synthesize and secrete T3 and T4. Parafollicular cells or the C cells, these are responsible for the secretion of the calcitonin that is going to lower your blood calcium levels. Rich vascular connective tissue. Coming to the disorders, this is also important. Hyposecretion first. Cretinism during pregnancy causes defective development, mental retardation, low IQ and abnormal skin. Here, physical abnormality can be reversed by the treatment, but mental retardation cannot be reversed, okay? Coming to the myoexedema or the Gulf disease is deficiency of TSH, thyroid stimulating hormone. Simple goiter or endemic goiter is deficiency of iodine, and here you are going to see enlargement of the thyroid gland. Here in hyposecretion we have exophthalmic goiter or the Graves disease, that is enlargement of the thyroid gland. Protrusion of the eyeballs, high BMR, weight loss. Now why weight loss? Because the BMR is high. That means your metabolism is high. High BP, insomnia, high body temperature and muscle weakness. So I guess that's it for today. We are done with thyroid gland. I hope you have understood. Thank you very much.